blastomycosis had acute fulminating respiratory failure, requiring prolonged external ventilatory support. Treatment consists of antifungal chemotherapy with two drugs and administration of corticosteroids. Restrictive ventilatory impairment and exercise-induced hypoxemia persists at 1 year after completion of therapy. Application in medicine. The patient reported to have myalgias, arthralgias, chills, fever with a temperature of 39.2 centigrade and upper respiratory symptoms occurred. A chest radiograph showed evidence of pneumonia in the left upper lobe. Cetronson and azithromycin were administered intravenously. Azithromycin and albuterol inhaler were prescribed, and the patient was discharged home. Although the patient has persistent symptoms, prednisone and cough syrup were prescribed. Doctor reported exudation, fever with a temperature of 38.9 centigrade despite having taken acetaminophen, and cough with blood thin sputum and pleuritic chest pain that prevented him from sleeping. Pros and cons. Pros. Through bronchoscopy, bronchoalveolar lavage fluid was obtained from the lingula and right upper lobe. Associated routine and fungal cultures were positive for P. dermatitis. A positive urine test for histoplasma antigen is compatible with a diagnosis of blastomycosis. Cons. Progressive hypoxemia developed because of worsening volume overload and a continuous infusion of bumetanide was begun. Anuria and hyperkalemia developed, and continuous venous demofiltration was initiated. The patient underwent cannulation for venous extracorporeal membrane oxygenation (ECMO). The patient died later that day. Diagnosis: disseminated pulmonary blastomycosis involving the hilar lymph nodes and spleen, early hepatic cirrhosis, and acute tubular necrosis.
How to get rid of pneumonia. Are you coughing more than normal? Do you find yourself spitting or coughing up phlegm? Do you feel pain in your chest when you cough, or even when you take just one deep breath? Do you feel tired and break into chills more often? If you sense your overall health gradually weakening on top of these symptoms, it's highly likely that you have pneumonia. The good news is that this illness is highly treatable and curable. However, you need to be patient and committed to getting well in order to see through the treatment period so you can come out of it a healthy victor. So, to learn how to get rid of pneumonia, take a look at the following steps. 1. First of all, you need to make sure you have the right diagnosis. There is more than one type of pneumonia. You'll need the help of a doctor to determine whether the type of pneumonia causes could be viral, bacterial, or fungi. 2. Since community-acquired pneumonia is the most common, it's likely that you have this kind. If you have been officially diagnosed with this type, you can choose to undergo treatment at home. However, if you are over 65, require breathing assistance, vomit to an extent where you can't keep down medicine, have low blood pressure and body temperature, and get confused about time and people, you'll need to be hospitalized. Children younger than 3 months who have acquired pneumonia also need to be hospitalized for proper medical treatment. 3. If your doctor deems you suitable for home treatment, you need to prepare a couple of things in order to ensure that your home-based recuperation will be successful. You need to involve the people who live with you in your treatment, as you'll need help and a lot of rest to speed up your recovery. 4. Make sure the room you plan to stay in is comfortable and well ventilated, but not drafty. Put up curtains or blinds to keep out sound and regulate the temperature. You may also want to stock up on water in your room so you can hydrate yourself regularly. Make sure to reduce contact with others to avoid passing the illness and contracting other illnesses since you have a weakened immune system. 5. Follow your doctor's instructions. Take the prescribed medicines, and stick to the medication schedule. Never take supplements or other similar products without consulting your doctor first. 6. Drink a lot of fluids to help loosen mucus and make it easier to expel them. Allow yourself to cough, as it is your body's natural way of healing itself. However, if the coughing is getting too much for you to handle, Drink warm water mixed with honey and lemon to soothe your throat. Avoid using cough medicines, as these may prolong the infection because it keeps you from expelling the accumulated mucus in your lungs. 7. You can take ibuprofen or paracetamol to relieve pain or reduce fever. Don't take the former if you have asthma, have a history of stomach problems, or are allergic to aspirin or non-steroidal anti-inflammatory drugs, NSAIDs. 8. Avoid smoking or exerting yourself physically, even when you feel a bit better. Your body needs all its energy and strength to heal itself. 9. Although the recuperation period may extend to a month or a little over a month, you should consult your doctor if your symptoms don't start to improve a couple of days after starting treatment. Remember that a crucial aspect in how to get rid of pneumonia is following the treatment plan and sticking to it.
Respiratory failure happens when not enough oxygen passes from your lungs into your blood. Your body's organs, such as your heart and brain, need oxygen-rich blood to work well. Respiratory failure also can happen if your lungs can't remove carbon dioxide, a waste gas, from your blood. Too much carbon dioxide in your blood can harm your body's organs. Diseases and conditions that affect your breathing can cause respiratory failure. Examples include lung diseases such as COPD, chronic obstructive pulmonary disease, pneumonia, pulmonary embolism, and cystic fibrosis. Conditions that affect the nerves and muscles that control breathing, such as spinal cord injuries, muscular dystrophy and stroke. Damage to the tissues and ribs around the lungs. An injury to the chest can cause this damage. Drug or alcohol overdose. Injuries from inhaling smoke or harmful fumes. Treatment for respiratory failure depends on whether the condition is acute, short-term, or chronic, ongoing, and how severe it is. It also depends on the underlying cause. You may receive oxygen therapy and other treatment to help you breathe.
Pneumonia is very similar to acute bronchitis and chronic bronchitis. However, this is heralded by horrible fevers and many times shaking chills. The chills are almost unbearable. The high fevers get over 102.0. Many times I get a phone call, I've got a temperature of 100.2. That's not really a fever in my book. Doing this for 17 years, a fever is 102.0 or higher. It's also seen with an incredibly painful, productive cough, typically with blood streaks in the sputum. It's crucially important. Many women, they're girly girls, they don't want to bring up the mucus and they don't want to look at it. This is very important that when you're coughing with this coughing jags, you bring the sputum up, you spit it into a white piece of like toilet paper or a tissue, and typically pneumonia has blood-streaked sputum almost always. Many things cause pneumonia: tuberculosis, bacteria, even viral. Many of my elderly patients, 65 and older, well, I got the pneumonia shot, so I can't get pneumonia, right? That's not true. That's not true at all. There's 150 different viral infections that can also cause pneumonia. The pneumonia vaccine only protects against the killer pneumonias, streptococcal and pneumococcal, but you can still get many different kinds of pneumonia. So if you're seeing a blood-streaked sputum with painful productive cough and high fevers greater than 102.0, you really need to be seeing your physician.
Issue applied in Ecuador. In Amounting to 1,190, the number of severe pneumonia cases diagnosed and treated in public health units in the province of El Oro in the first 33 weeks of the year 2012. The amount of cases, representing a rate of 18.5 per 10,000 inhabitants, is significantly higher than those recorded in the same period last year. Among the diseases in the pathological profile, severe pneumonia, which accounts for 3.6% of the total, are located in the third ranking, led by influenza with 32% and dengue fever with 4.8%. The environmental and climatic conditions contribute to the increased incidence of pneumonia and respiratory disease that involve infection and inflammation of the alveolar spaces of the lungs.
Pneumonia is inflammation in your lungs caused by an infection. You have two lungs, one on each side of your chest. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon, and when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries. Then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. If you have pneumonia, your airways or lungs have an infection caused by germs, such as bacteria, viruses, fungi, or parasites. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. Hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you may expel them by coughing. Sometimes germs make it past your mucus and cilia and enter your alveoli. Normally, cells of your immune system attack these germs, which keep them from making you sick. However, if your immune system is weakened due to age, illness, or fatigue, pneumonia-causing germs can overwhelm your immune cells and begin to multiply. Your bronchioles and alveoli become inflamed as your immune system attacks the multiplying germs. The inflammation causes your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. If you have lobar pneumonia, one lobe of your lungs is affected. If you have bronchopneumonia, many areas of both lungs are affected. Pneumonia may cause the following symptoms: difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. Pneumonia can lead to serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. Bacteremia occurs when the bacteria causing your pneumonia move into your bloodstream, where they may travel to infect other organs. In some cases of pneumonia, a large collection of fluid and pus, called an abscess, may form inside one of your lungs. If an abscess forms around the outside of your lung, it's called an empyema. Possible treatments for pneumonia include Antibiotics, if the cause is bacteria or a parasite. Antiviral drugs, if the cause is a flu virus. Antifungal medication, if the cause is a fungus. Rest and drinking plenty of fluids. And over-the-counter or OTC remedies to manage your fever, aches, and pains. If you have severe pneumonia, you may be admitted to the hospital and given intravenous antibiotics and oxygen.